We are checking in now with the Hartford Hospital Pain Treatment Center. Medical Director Dr. Jonathan Cost joins us to give us a little bit more insight into how telemedicine is working and those digital health apps that the center is using. Thank you for joining us, Doctor.
Thank you so much for having me.
I think it's very interesting how technology is playing such a huge role right now during this pandemic. Have you found that telemedicine and the digital health apps are just as effective as in-person treatment with patients?
Yeah, so they have, without a doubt, telemedicine in particular has found a definitive niche in terms of how it helps medical practices. Like most medical practices throughout the country, we had to start doing telemedicine quite urgently through this pandemic. And it has, without a doubt, helped us get through this, helped us communicate with patients better. Without a doubt, has provided us with information regarding the patient. And we'll also find a place well after this, hopefully, pandemic, after it resolves. Just prior to the pandemic, the Hartford Hospital Pain Treatment Center and the Spine and Pain Institute at Midstate also developed and began utilizing an application that is a HIPAA-compliant web-based application that actually monitors patients while they are at home. So the timeliness of all of this could not have been better. So it's been extremely helpful for us during this period of time.
So we're talking about tracking and monitoring fluctuating pain levels and even psychological states?
Correct, right. So what we're able to do, typically the office visits maybe every 3 to 4 months, but it's that in between those 3 to 4 months is kind of a void. We really don't know what's happening with the patient until they come in, and this is in the past. But what this application does, it provides us with enormous amounts of information in between visits. It'll provide us information regarding their pain level, their functional level, their, depression and anxiety are very high with patients with chronic pain conditions. So it helps us to guide us regarding depression and anxiety. It'll help guide us in terms of the effectiveness of medications, the effectiveness of procedures that they may be having, and the effectiveness of those medications. Along with it also utilizes devices that collect vital signs, such as blood pressure measurements in between these office visits. It allows us to communicate with the patient real time in between these office visits, and also identifies what we call alert levels, which are basically abnormal levels that we have to react to quickly. So we never had this prior to the ability to use this application, so it's filled an extreme void.
No doubt.
In between.
Oh, I'm sorry to interrupt. It's personalized, a lot of this information for doctors and for the patient. We unfortunately are running out of time, but thank you so much, Dr. Jonathan Cost, Medical Director at Hartford Hospital Pain Treatment Center. We appreciate your time.
Great. Thank you for having me.